Good afternoon, everybody. So if this has worked, if you've successfully logged in, you're seeing me. Hello, I'm Geraint Thomas. You should also be seeing a slide deck. I can see some, the numbers are going up. I can see some more people are coming in. So I am going to actually pause for a minute or so just to let those people come in. So you are definitely in the right place if you're here for this fantastic webinar, COVID-19 and social care, how to stay strong, safe and supportive. Got some great people attending this. Okay. That's given everyone a minute to settle. So hopefully you've got your drinks and you're settling into this. This is going to be a really exciting hour and a half that you've got with us. Let me introduce myself. If you can just change the slide for me. So welcome, I'm Geraint Thomas. I worked in social care in the UK for well over a decade now. I've worked with nearly 200 care organisations from big care home groups and the Boopers of the world through to the wonderful domiciliary care companies run by a husband and wife, and I thoroughly enjoy it. I'm also a geek. I like my technology. For me, data's cool, and I'm going to be taking you through the next hour and a half. So if we can show the next slide, let's see what the next hour and a half looks like. Okay, so we've split it in the way you can see. We've got module 1, where you're going to hear a bit more from me and from a lady called Joss Gaynor, Head of Foundation at Disabilities Trust. We're going to share with you the kind of current state of social care in the UK. We'll try not to be too negative, but I'm sure you're all aware we are challenged right now. But we're going to shine a spotlight on that. Then we'll move into module 2, where you'll listen from Adrian, Simon and Ernie. And in this session, we're going to talk far more about the people and processes that you've got and the future state. What opportunities are there right now? And you're going to get loads to take away. So, please have your Word documents open or your pen and paper to jot these down. They're going to be fantastic. And then we're going to finish with probably the most exciting bit, which is the questions. We're going to put those to the panelists and get their expert opinion and thoughts on things. So if you go to the next slide, we'll show everyone how to do that. So if you haven't used this before, it's called Slido. Please type sli.do into an address bar, or you can type it into Google or Bing and just click on the top option. And it's a very simple and easy to use system. You're just going to get a nice clean box and it's asking for you for an event code. The event code is United We Stand. So just type that in. No need to use capitals, no need to use a hashtag. It puts that in automatically for you. Just type United We Stand. And what you'll do is you'll be able to ask questions in there. You'll also be able to see questions that other people have asked. So I encourage you to read some of them and you can vote them. So if you kind of put your name against them, it also shows that you're interested in the answer. And that way we can ensure in that last half an hour that we're answering the most pertinent questions. It's really easy, you'll have no trouble doing that. I'm just going to give a minute. Okay. Okay, on with session 1 then. So in this first part, you'll be hearing more from me, which is a great thing. You're also going to be hearing from Jocelyn Gaynor. She's Head of Foundation at Disabilities Trust, very focused on mental health. I'll introduce you to her when we come to her slot. So if you can continue. So I'm going to start off kind of shining a spotlight on the current state of things in the social care sector, things that all of you on this call now are challenged with. And by doing that, I am being honest with you, I am going to start off quite negative. I think it is important, though, to take a moment to look at the current state of things, to acknowledge what's going on in our sector and to empathise, because it is rather challenging. So if we can go to the next slide, I'm very much starting off on a hard-hitting point here. just take a minute to look at it. So this is data from the Office for National Statistics. It's data for April. Now the May data isn't out yet. I'd expect it to be a much more optimistic look. I'm hoping April is the worst the UK has had to suffer in terms of COVID deaths. And that's what you're seeing here by age range. And it's really quite profound, isn't it? You know, if you kind of take a mark in the sand at that 60 plus mark, gosh, you know, the vulnerable, the elderly are absolutely the worst hit by what we're dealing with right now. So the 60s and over, and the 60s and overs are the ones that we are responsible for. You and your organizations are responsible for looking after these people, and it is difficult right now. You know, it's difficult anyway. But look, I can't think of anything harder hit really in terms of loss of life than our sector. And you know, I will dwell on the fact that I can't help but feel, you know, allow me if I can to suggest, if this was inverted, if this graph was inverted and it was the young that were being impacted rather than the old, I can't help but feel the leaders of this world might have perhaps reacted with more pace, with more focus. And it's been really challenging for care homes and domiciliary care in this space, and you can see the evidence here. If you go on to the next slide, we've also got to consider the people that work in this sector, the angels that turn up every day and deliver fantastic services to these vulnerable people. They are also putting themselves at risk. The data here from the same source is suggesting, you know, there's a marked difference. If you work in social care, you are more at risk. And this is exposure, really. There is data available around exposure, which jobs are putting people in exposure of COVID, and social care is right at the top, only beaten by healthcare. If you're interested, the most at-risk occupation in the UK is dentistry, as you can imagine, and the second is paramedics. But social care work is right up there, as this data kind of evidences. And do let me say this, I work in this wonderful sector. I've spoken to a head of nursing in a charity. I've talked to an occupational therapist in Norwich. I've spoken to a whole ward in a hospital in South Wales. I've spoken to my neighbour who's a carer. And one thing they've all said to me, and it tends to go like this, they say, Geraint, I can't say this out loud, I'm not allowed to, but I really wish I wasn't a key worker. I wish I was furloughed. You know, I'm working long hours. I'm coming home to my kids, putting them at risk. And I really wish I wasn't. It's really tough at the moment. And we need to acknowledge that. If we go on to the next slide, if we look outside of our sector, there's also a broad impact right now. This is a study that was undertaken outside of the UK, all around Europe. Glasgow University was quite involved in this one. And it looked at a national study across the population. I'm going to pick out that last paragraph there. You know, 1 in 2 people in the UK felt down, depressed, or hopeless about the future. It's really a difficult space. But, you know, this is where I am going to try and get more positive. You know, now more than ever, I think you'll all agree, mental health is being talked about in the UK. We had Mental Health Awareness Week a few weeks ago, lots of things going on all around the country for that. I know Radio 1 have regular themed talks around mental health, and they target your kind of 20 to 30-year-olds, which are your highest risk groups. So there is a lot going on. I think the Princes do a lot as well every time I turn on the news. So that's a real positive. And at a time now where people do need to be mindful of mental health, it is being talked about. So if you can go on to the next slide, to continue with a positive line, you know, I have seen also at the same time, COVID has presented an opportunity for our sector, for a lot of companies that you're running, and I hope you have seen some optimism. I've seen some amazing kindness going on. I've seen carers using their personal phones for service users to contact their loved ones. We all know of industries and factories that have changed their tooling to mass produce PPE equipment. And that's been fantastic all around the UK. My neighbour has a 3D printer, and he started printing, over 100 clips for face masks, and he sends those off every week to a factory to be compiled. So, there's some fantastic things done. No one's asking for anything in return, and it really is optimistic. So if you can click the next slide. And, finally, I have a graph to show you that's going the right way. This is hot off the press, data shared by the Office of National Statistics just last night, I think it was. And please, I'm not belittling the loss of life that this is showing, but it is giving me a sense of optimism that the data is going the right way. If you look at the data, a headline is, a third drop in 1 week. If you look at the last bar there. So, things are getting better, and that's really a point to acknowledge. If you can show the next slide. Another thing to point out is this data that's been shared around gross value adding. So what this is showing is the sectors of the UK and what their contribution to the economy is at the moment. And look, health and social care is right up there at the top. There is no sector in the UK giving back more to the economy than ours right now, in the salaries that we're paying, in the stuff we're procuring, in the services we're delivering. And if economists to be believed, they suggest this is a really good indicator for which sectors are going to bounce back the quickest during a recession. So, whatever economic challenges we've got to come, our sector is really well placed to bounce back as strongly as it possibly can. So that suggests perhaps, we're coming to a point now where we want to start investing in our companies. Growth isn't out of the question at the moment, like it is for many others. So I'm going to come to my last slide now, and I tried to think of two things that I've really seen as a benefit of the current crisis. And these are the two that I've got for you. So one, for the first time, ladies and gentlemen, we have a recruitment pool in the UK, finally. Not to be a downer about it, but we do have a lot of waiters and waitresses, people working in cinemas, hoteliers that are perhaps out of work. And I've had great success working with a care home in Mid Wales, where we did a massive recruitment campaign through social media, really focused on these individuals. They've got no vacancies. They've never had that since they've opened. And they filled a lovely pool of bank staff as well to call upon. I've seen another care home group focus instead on the restaurants, reaching out to restaurants saying, if you've got staff that are furloughed, why don't you give them to us, lend them to us as bank, we'll pay them, and when you reopen your restaurant, you can have them back. Some really innovative ways of doing that. So if you're not doing it already, if you're challenged with staff, hey, who isn't, I encourage you, try and do a quick little strategy to see if you can try and tap into that. And then the other one is I'm really enjoying the innovation that I'm seeing. Be honest, how many of you were thinking about using Skype or Microsoft Teams or Yammer or social media, but you never really bit the bullet, you never took the plunge, but suddenly you are? How many have thought about doing an intranet and finally have got around to doing it? You guys are probably some of the best because you're all dialed into this, asking wonderful questions on Slido, so I'm sure you're fine. But if any of you are not looking to digital for lifelines, for solutions to some of the challenges you're feeling right now, I encourage you to do so. There's some really good tools on the market that can really help. Data is more important for reporting now than ever to know what's going on in your care homes. So yeah, I'll encourage you, these two, if nothing else, if you've got somebody in your organization that's bored, give them this to do. I'll encourage them. So thank you. I appreciate I did get negative on that one, but I think it was important to acknowledge. It's close to my heart. It hurts the last couple of months have hurt, but things are really bright at the moment, and they're getting brighter. So, moving on to our next speaker. Okay, so Joss, if I can invite you to turn your camera on so we can see you. So Joss Gaynor, I've mentioned her as head of foundation at Disabilities Trust. She has led on the development and implementation of national good practice projects inside and outside of Westminster. So Joss is all about mental health in the UK, a real expert in that space. So hi, Joss. Can you hear us? Is your microphone on?
Hi.
No?
Yes. Yeah.
Yeah, you're there. Wonderful.
No,
Brilliant. I'll
I'm
hand
on.
over to you. Thank you very much.
Hi, everybody. Lovely for you all to join us today. So thank you for that. So I'm going to talk to you about some of the impacts that we've seen from a wellbeing perspective on our staff at the Disabilities Trust, and some of the people in our services, and some of the things that we've put into place to try and support them through this difficult time. As Garant has already alluded to, coronavirus and the restrictions that have come about with it have been uniting in their uncertainty and have unsettled and impacted on all of us to some degree. And the response to coronavirus has really abrupt changes to our everyday lives, and many of us will have felt isolated or disempowered, or at some point during the lockdown, all of us will have experienced a loss. So that be that our freedom, a loss of our health, a loss of our loved one or a resident or a colleague in our services, or even the loss of the job as we used to practice. And for our staff and the people that we support, they're experiencing these negative impacts and have been presented with a unique set of circumstances to navigate that none of us have a print or a roadmap for. So our staff tell us they're feeling powerless, overwhelmed, frightened and anxious about the job, doing the job that they care passionately about and supporting the people that they're so used to supporting. And they're having to offer support on their own, whilst also providing reassurance to some really distressed loved ones about the impact and the support for the people in our services. Some of our staff are also feeling that they can't offer that support and care in the ways that they used to. And the people in our services are feeling all of those things: sadness, anxiety, anger, frustration, and some are going to understand or remember the reasons why their care has changed, and that why they may not be able to their loved one. And I'm sure so many of you are experiencing and witnessing that in your services at the moment. Slide, please. Sorry, if I could have the next slide, please.
It's there. It's just going to catch up.
So the Office of National Statistics have reported that 63% of people asked reported feeling stressed or anxious, whilst 53% of those have it's affecting their well-being. And a UN policy briefing found that during the pandemic, as it says there, 47% of healthcare workers reported needing support. In Canada, 50% in China reported depression, and 42% in Pakistan reported moderate psychological distress. And by way of comparison, the 2003 SARS epidemic saw 29% of healthcare workers experience distress. So we really are in unprecedented times, which I think could have really profound impacts on our staff and the people in our services. Can I have the next slide, please? So I think it's really important that we support people at this time. And one of the first things that we've been doing in the Disabilities Trust is we've been listening for the different voices. just on cue. So many people are experiencing this in really different ways, even within the same role or in the same setting. And it was exciting to start with. There was a blitz spirit. However, as the lockdown has progressed and as we move through easing, and in services like ours, there are differences that arise. So some people can work from home, some can't. Some people are in lockdown alone. Some houses are bursting full with the list goes on. And I think it's crucial for us to listen to all of those different voices and experience so that we hear support the full range of needs of our staff and the people in our services. And we need to give people the space and the time to share their emotional reactions, recognizing that people are going to tell you in really different ways. So we need to look for the things that unite people in a positive way and how we can collectively contribute and articulate it and really connect to that meaning and the purpose of what we do now more than ever. So at the Trust, one of our values is to have heart, and I think that now more than ever, people across our organisation at the Disabilities Trust have really lived that value and held on to it in all of the difficult and challenging work that they have faced. The next slide, please. So I think the next thing that we've worked really hard on in the Trust is communication throughout this time. And anxiety and stress kind of dances in the unknown. If we say nothing, we create a vacuum in which anxiety can thrive. So it's critical we give as much information as we can. So at the Trust, we've consistently communicated what we're doing to keep people safe and well. We're not making any promises, but we are sharing our processes so that people understand how the organisation is working. And this transparency we found can be really powerful way to alleviate stress for the people in our services and our staff. And the Trust has also been working to ensure that our communication channels meet people where they are, and we're using a range of different tools. If we think about what I was just saying, listening for the different voices, it's important to have the communication channels that meet those voices and those needs. So we've been using webinars like this, we've used Yammer, emails, posters, calls, even socially distanced face-to-face engagement with colleagues. And we've also set up a coronavirus helpline for our staff so that they can call and ask questions and raise the need for support. And I think it's even more important at this time of uncertainty that we're telling that we appreciate them. And we're open and we affirm people's value to the organisation. And at the Disabilities in many different ways, but we've been sending out wellbeing parcels to services and staff to continue to show how much we appreciate them and how important it is to us as an organisation that they look after their own well-being at this really challenging. And if I could just have the last slide, please. So in all of this, we've tried really hard at the Disabilities Trust to kind of create moments of calm. So having acknowledged the anxieties and the emotions, it's really important that we create the calm and the space for that calmness for our staff and the people in our services. And the opportunity to have that space allows people to step away from the never-ending challenges that they're facing at the moment and to really try and maintain their well-being. So at the Trust, we've in place a programme of yoga and mindfulness sessions, which can be accessed anytime and anywhere for our staff. And we've also encouraged the humour and the fun to soothe the anxieties with focuses and consideration for things outside of the immediate that's going on. And we've found the positive stories, so the hundreds of acts of kindness that Geraint talked about in our services and in our communities that remind us of the good things that are always there and will be there and more as we move forward. So thank you, and I look forward to hearing your questions.
No, that's brilliant. Thank you very much, Josh. No, it just rings true, doesn't it? If we can, I like that phrase, you know, create moments of calm. And doing that through communication. Love to hear that you've got that help desk that people can call. Yeah, I think everyone will agree that's really useful. Thank you very much. Okay, so we're going to move on to the next session. So, cheers. So for those of you that have already done it, thank you. We have had some great questions coming in already. So if you can go to sli.do, you'll be able to see those, and you can put your name to them if you also want to know the answer. Make sure we're answering the right ones. No doubt we're going to have too many to get through, so please do vote the ones you like the best, so we answer those first. And if you haven't done it, just pop onto there, type United We Stand. Okay, so Josh, if you can turn your camera off, and if we can go to the next slide. So in part two, we're going to get a bit more practical. We're very much going to see what's going on in some great services in the UK and talk about what you can actually do off the back of this webinar to make sure things are supportive and safe. So we've got Adrian, Simon and Ernie. You're going to really enjoy listening to these. So if we can go to the next slide, I'll introduce Adrian. Okay, so Adrian is the director of Avondale Care in Scotland. I better get that right. He's got over 13 years of experience in providing complex adult care services. Adrian's incredibly practical. He's got an awful lot of very real things that you can take away, things that he's experienced. He's going to share those with you now. Hi, Adrian.
Hi, Geraint. Thank you very much for inviting me along today, and welcome everyone. Yeah, so I'm just going to talk through some of the things that we've experienced over the last 12 weeks, and you know, the anxious times that we're going through, and just some of the.
Have we lost Adrian there? Okay, I'm just checking on his connection, make sure it's working. Okay, everybody, hopefully you can still hear me okay.
Yes, Geraint, we can hear you. If you perhaps go to the next speaker, and we can come back to Adrian later if we get him back.
Okay. I was just checking there, ladies and gentlemen. I was just worried that it was me that dropped out of that call. It wasn't Adrian. That's so. And so if we can jump past Adrian's slides, there we are. That's the beauty of having multiple panelists. But we'll get Adrian back, and we won't miss what he said. He's got some fantastic slides to share, so we'll make sure that you do get a chance to listen to him in a moment. But Simon, if you can turn your webcam off. We'll get that on there. Hi, Simon. So, Simon, like, you know, I'll repeat what I said earlier. Simon, data is cool. So Simon has consulted, project managed, implemented numerous solutions across mental health and aged care in the UK. Very much coming at it from a user's point of view. He knows what staff like to use, what they don't like to use. And yeah, you're really going to enjoy what he's going to take you through now. Thanks, Simon.
Thanks very much, Geraint, and thanks to everyone for joining today. As has already been alluded to, care businesses are going through a tough time at the moment. The last few months have exposed difficulties in obtaining information in a crisis. So if you're not able to visit your home for any reason, whether you're shielding or whether you've prevented non-vital staff from going to site, it leaves you a little bit exposed and that you don't have oversight as to what is actually going on at the home. So you could have, you know, be blind to staffing situations if you're short of staff on a particular day. You could be unable to see any issues with residents in a care home, unless obviously you get a call, which most staff do, but sometimes you'll miss things that are happening. It's estimated 75% of care homes in the UK still don't have an electronic care planning solution at the home. And of the ones that do, some of them don't have systems that you can access away from the home. So if you can't access the computer at the home, you can't actually get the information that you need. So if you can go to the next slide, please. So we have to ask the question, how good is the data that you have and how long will it take you to actually get it? So is the data that you access in real time? So can you actually get your staff to enter what is happening in terms of care at the time it actually takes place? So literally as soon as they've had any interaction with a resident, are they recording that information? Do you think this information is accurate? So if they can't do it in real time, which a lot of people can't, as I've already alluded to, when are they actually writing this information? It's often in a break when they've finished a major part of the day or towards the end of a shift, which means that they're trying to store up all the information that they've had throughout the shift and then trying to write it all down. They won't have enough time to do that. And also, you know, no matter how good someone's memory is, they're going to forget some detail because there's so much to do. And then that leads to the next question. Could you trust that information to make business decisions, or are you using hunches from your experience? Now, often, obviously, if you're experienced in the trade, as it were, your hunches are often right. You will know that certain things are happening just because of behaviours that you've experienced over the years, but you still need that data to back it up. If you're going to the bosses of the company to try and get them to spend more money on a particular issue, and you don't have that evidence, it's much harder to convince them to spend money, especially at the moment. And the last thing to ask on this is there any information that you're not able to get that you need? So the systems that you have in place, are they able to record all the information that you want to actually be able to use to plan what you're doing with your business? So if we go to the next slide, please. So if we take it that you have some systems in place, how easy do your staff find those systems to use? So we all know that there's a whole range of staff that you have across a care home, from young who are used to using computers and smartphones to older staff who may have been working in the care sector for a number of years and are used to using paper-based or older electronic systems. So are the systems that you have in place that you're trying to put in place, are they intuitive? Are they the sort of thing that you can pick up and very quickly get your head around? I always use the analogy, if it's as easy to use as Facebook, then people will be more likely to adopt it. So that's a big consideration when you're looking at systems. Then you have to ask yourself, have they had appropriate training and support? So often when you put a system in, you will get an amount of training from the supplier early doors, and it'll often be a train the trainer scenario where they'll train a group of people who then will disseminate that information to everyone else. So is that training from the supplier good enough for you to be able to do that? Have you got support afterwards? So do they just leave you to it once you have started using the system, once you sign the contract, or is that system supported ongoing? And the other thing that is often forgotten about, people think that the system will do all the work for you. And that is a common failing, and it's definitely a common failing that I've noticed in care. You need to have clarity around policy and process for any new systems that you put in. and to check that the staff are competent to actually use them. So you may have a great set of policies pre-electronic, but when you change the system that you're using to record information, you need to look at your policies and procedures around that as well, because some of those will change because you may be asking staff to do something in a different way, or even do a slightly varied role because you put a new system in place. So you need to make sure that that is looked at quite carefully with your operations team and with your care and quality teams to make sure that you're not missing a trick. And then you also need to make sure that there's support around with staff to make sure they're competent in using it, and using it in a way that you want them to. If you can move to the next slide, please. The last thing around this that I'll go into, and you'll hear from Adrian and Ernie about some of this stuff later, is the IT infrastructure that you have in place supporting your staff. So are your computers and other equipment, I mean, often you're using sort of smartphones or tablets for some of these systems, are they still fit for purpose? So if you've put a new system in, do the computers have the appropriate operating systems and software to be able to support any new systems that you're putting in place? Does the home have good connectivity and bandwidth for broadband to aid the current systems or any new systems that you may be thinking of? So that's often a problem because you've never had to think about it before, and you may be running on very old broadband and Wi-Fi technology. The home may have lots of black spots when you walk around with a handset, for instance. And it's stuff you have to think about because it erodes confidence in any systems that you are asking your staff to use if those things aren't in place. The last thing I'll mention is any systems that you buy, you need to think about whether they're sharing bits of information with each other and how easy it is to link those systems up. Do they allow for joined up thinking? So again, the other two, Adrian and Ernie, will talk a little bit more about their experiences around this, but you need to think about doing things around this to make your life easy, so you're not duplicating information in terms of having to type it in various different places. If you can develop ways to link the systems where you can push information that is needed by each system to each other, then that saves you time and removes the likelihood of errors. That's it from me for now. Hopefully that gives you something to think about. If you've got any queries or questions, please ask them, and we'll do our best to answer them in the Q&A session later. Thank you very much.
Oh, brilliant. Thank you very much, Simon. Yeah, you're absolutely right. You know, I'm a geek at heart. I'm seeing more companies buying software solutions now more than ever. You know, I alluded it to earlier. I spoke to an intranet company. They said they're selling more than they've ever sold before. And they're discounting it, thank goodness, for the current state. So yeah, people in this, I encourage you again, reach for digital solutions. They're incredibly useful at times like this. Brilliant, thank you so much. So Adrian's going to come back after our next speaker, but I'd like to introduce you to Ernie. So you can go to the next slide. There we are. So Ernie is the owner of Graham Care, 7 care homes in the southeast of England. So where Simon's talked to you a lot about your systems and your data, Ernie's now going to focus on the importance of your people, staff, relatives, auditors. You know, you engage with an awful lot of them. Welcome, Ernie.
Yep. So thank you everybody for joining us. Also good to have the opportunity to share what we're working on at the moment and the journey that we're on, probably along with lots of others, on trying to move forward and embrace the digital opportunity as best we can, but as just been said, always focusing on the impact on people, and in particular using technology as a way of bringing folk together, and ultimately making the outcomes that we provide for the clients far more personalized than they've ever been before. The big agenda we have right now is trying to get people away from treating them as homogenous groups and trying to look at them individually, and also to provide the service to them not in standard rounds, but as individual items of service. So it's big a change. So yep, we're excited about it and trying to use technology as our friend. So next slide. So we've kind of put down, I guess, 3 objectives that we're trying to achieve based on, I guess, partly where we've come from, but also with an eye to where we're trying to sort of get to, given that the digital journey is not one that can be achieved overnight. It is a journey, and it takes time, and it takes time both from the point of view of technically getting systems that's right for us, and also systems that folk that use them can have time to come through the journey with us and to change some of the ways that they work as well. The first sort of objective we've had is to try to get some sort of integration of all the information we have. The big difficulty, and what was painful, was when we first moved away from recording our information just on paper to recording some of it digitally, but having still some of it on paper was a really difficult place to be honest. For example, when one of our statutory partners, for example, an inspector might look through the computer records, but there's also paper too. So they might find it very inconvenient at least, or downright difficult at worst, to be able to interrogate one system and then cross-reference it with some separate files. That's always difficult. So the journey involves some difficult sort of transitional roads that has those difficulties. So in a way, to get the benefit of digital, one has to not just go to the starting blocks, you've got to keep on going along the way and try to have a good view of how data can be integrated, because then we have a half a chance of not only being able to understand the past, manage ourselves in the present, but start doing a bit of prediction of the future. So again, you can sum it up by saying we're kind of moving from living in the past to, at the moment, we're living in the moment, I guess, trying to live in the moment more, do real-time analytics, but then with a view to trying to live now with some sort of idea of what might be up ahead as a way of, well, safeguarding people, but also planning much better for them and giving something that's far better wrapped around what their needs are based on evidence, which is really good. But increasingly in the care sector, we're all working on, I guess, a landscape, a communal landscape, where we're not just there on our own with some kind of an institution behind closed doors. We need to be as open as we possibly can be, and using our digital journey to try to be in touch with so many stakeholders we have. So the stakeholders, mainly the clients we look after, but also their own friends and family that come, I guess, as a bit of a package with them. And I think very importantly is to recognize if we're going to be accountable to them for what we do to their nearest and dearest on a day-to-day basis, we need to be able to communicate with them constantly. And again, with them, is trying to communicate as close as possible to real time. You know, it was one of the things I keep saying personally, I'm sure we're all the same, none of us really like surprises. You know, we don't like to get news late, particularly if it's bad news. We want to kind of know it as soon as we possibly can. So again, the digital journey just helps us for people to know what's really happening and to be aware of things as soon as they possibly can be. So digital certainly helps us with that. But we also are accountable, of course, to our regulatory partners, and rightly so. It's a complex business we're in. People are extremely vulnerable that we look after. And the vulnerability they have means that we kind of need to be double accountable, because we not only need to be accountable to our clients and their families, but probably be able to demonstrate it for any new clients we get that we've got some sort of track record and they can be confident in what we do. And therefore, for our regulatory partners to help to translate what we do into some sort of way that the outside world can understand. There's all this hard data we have, but it's trying to get that translated into soft sort of outcomes. Obviously, the privilege that we now have, I guess, is that we've moved on from old style regulation based on room sizes, corridor widths, or door widths or whatever. It seems like an age ago that was what regulation was based around, to client outcomes. But if we are going to really reflect outcomes properly, we need to serve our regulatory partners well by giving them a proper basis to make their judgments. Because if they make judgments that maybe we feel aren't accurate ones, well, maybe it's our fault. We haven't given them enough evidence that they can make rounded judgments on, to be honest. So I think the digital journey makes a huge impact on being able to look all ways, as it were, and communicate not just with clients and their families, but with the main people in the outside world as well. So that's just what we're trying to achieve in general terms. So next slide, and we'll think a bit more in the detail of what that actually means in practice. So basically 4 elements we want to look at, and we've got along the bottom there a lot of the partners we actually work with to be able to achieve what we're doing. One of the first points, I think, in the objective was to how we can sort of look at data on an integrated basis. And the immediate challenge that comes in trying to achieve integration is which systems do we employ to achieve that integration. One, I guess, solution that always comes up is, can we not have just one systems provider that will be for everything? I think the NHS tried that a few years ago, which was very, very expensive. And I think what we do, we mustn't underestimate the multifaceted nature of what we do. And there's a lot of specialist areas in social care, actually. And therefore, to expect one system provider to be able to sort of do all aspects of that with the depth that's needed is going to be really difficult. I think was mentioned a few times already is having care planning software, and I think is only vast majority of homes don't yet have it electronic, but the electronic system for care planning is one of the key ones. We, as it happens, work with person-centered software, because what we felt was, and one of the things we liked about that particular system is that they don't profess to be able to do everything. They only do care planning and care recording, but in a very open way and in a way where we can be interoperable with other systems. So, and that has set the theme for our digital development, is having systems that are the best ones we can find for us in each of the specialist areas, but arrange them so that they can basically talk to each other. So this, as the geeky guys talk about, this interoperability is, I think, very, very important. So for us, we've got separate systems for care planning, recording, medication management, call bell collection and recording, staff rostering, good old Planday, and then systems to help us know where staff residents are so they can be accountable and us to them. But then also, very importantly, particularly when people are vulnerable, say at night, is to have systems that can monitor how they're really doing and not us annoy them every couple of hours by disturbing their good night's sleep and doing things which are not very not nice to be disturbed during the night. So the first point is, anyway, having best in breed systems and working with folk who have real depth in each area. And I think the more we look into each of these systems, the more, to be honest, we're almost humbled by the amount of knowledge and expertise there is deep into each of these specialisms. I guess I could mention Planday with its, it looks like rota work should be, it's really simple. It's only a spreadsheet, isn't it? But actually, to make it work in community with all the stakeholders that need to know about it, it actually does need a system, and that system behind it is really complicated, even though the user might think it's easy. So the more we try to work in it, it's the tip of the iceberg. Obviously, good systems need to be really easy to use, but the easier to use they are, probably the more work's had to have gone on in the background. So I think that's just a recognition for what a good system is from an end user point of view, and one that's there to be developed, but mainly to be interoperable. Then the big thing is, how do we really get at this data on an integrated basis in a way that we can make sense of it? And what we're working on right at the moment, we've made fair bit of progress already, is establishing what we call a data lake, or the geeks call a data lake. So this is getting the information from these various systems coming in what you might call tributaries, running in to this big lake and keeping it, you could say, populated with this disparate data, but in a way that then we can start analyzing it as one. And it allows us, actually, to be honest, to be agnostic as to even which system. In certain cases, we have, say, more than one system for a specialism, so it doesn't really matter what the provider is, as long as we can get the data into the lake and then start having a way of analyzing it. So, and once we get coming into the lake in real time, we can basically move on from looking from our compliance being retrospective compliance, i.e. looking back, to real-time compliance. So not sending a report today of what some shift may have done yesterday, but actually engaging with the shift today and what they're doing today, because yesterday's work can't actually be fixed in social care in one sense. It's history, it's gone. You can't change the outcomes you created for folk yesterday. You can only do that today. So this is a huge move forward, and I think will really help us to basically cut out a feedback loop that's really inefficient but not very effective either. So that's from the point of view of the staff. But then we kept talking about the clients themselves and their nearest and dearest. Is how we communicate with them, and actually to communicate with them really well. If you've got lots of different systems, we're working at the moment on bringing that disparate data together into one app so that they don't have to log into 6 different applications to see what's going on. They can have one app, and where we can have some good analytics that makes, again, what's really complicated in a huge data lake into some really simple metrics, and they can have choice over which notifications they want to switch on, just like on that Facebook test I think we had referred to earlier. There's obviously piles of options, but everybody's different, and we want to be able to let them see the things that's important to them. So with the amount of data we have and with the right systems that aren't that complicated, you can let people see really what they want to do. But the real excitement as we move forward is using our the latest in data analytics to be able to kind of look to the future and actually see where people are really at in terms of things that might be coming towards them that maybe aren't good for them, like a chest infection, UTI, maybe falls risks that we didn't realize, maybe indicators through their vital signs of end of life coming up that the staff just hasn't noticed or whatever at that point. So there's a huge amount of value, but ultimately it's about the people, and it's constantly bringing back what is a complex picture to how can we serve folk better, look at them in a more personalized way, and make their life more fulfilling and more worthwhile.
That's brilliant, Ernie. That's absolutely brilliant. Thank you. And you know, I'm a big believer also this best of breed approach. You buy the best solution for the problem, and you seem to have done that ahead of the curve. You know, I don't think there's many organizations that have digitalized as much as you have. And the fact that you found success in that, you found value in that, you're letting residents and their families and your auditors and commissioners benefit from that as well. Yeah, fantastic. Thank you so much, Ernie.
Thank you very much for the opportunity.
Cheers. Okay, so we do have Adrian back. Unfortunately, we've lost his video, but we're going to have him on audio only. His slides are quite important to share what has happened to his care company up in Scotland. So just a reminder again, Slido, we've had some great interactions, some really good questions, very taxing ones. You're gonna really put the panelists to the test and get some real insights. It's gonna be great. So Adrian, if I can invite you back, I'll see when you've come on and we'll be able to hear you. Any luck, Adrian? If you'd like to go on to the next slide, so people can start reading the slide while we wait for Adrian to join, I think that could be really useful. Okay, so what I'm going to suggest, ladies and gentlemen, is that that Adrian's going to join us the moment he gets his technical difficulties sorted. But until then, he's going to have to forgive me because I'm going to actually take you through some of the insights that he was going to share with you. So I do hope he pops up at some point to check that I'm not lying to you. But I have run through this with Adrian, so I am aware of the passion he's got for this and what he's going to share with you. So. You, as a care operator, have challenges right now. You have an awful lot of things that you're balancing, and it's really difficult to prioritize that. You've just heard from people like Ernie and Simon that talked about if you've got digital systems, you can use data to help inform where you prioritize. But if we can go to the next slide, there is a plethora of kind of outlines what you're up against, and it's good for us to go through this. So, you can be forgiven if you listen to your auditors that you're responsible for just your residents, but actually staff are anxious. Joss has shared some insight around that. Your residents' relatives are also your responsibility to a large degree during this time. And this anxiety is running through all the people in your organization, those that do the caring and those that are cared for. So you're trying to certainly balance all of that. And as Joss said, this is unprecedented times. The anxiety that's happening right now has never been seen at that levels before, in terms of infection. You've got staff off sick. Everyone's got staff off sick, but you've certainly got them off sick. You've got them self-isolating and shielding. These give you different solutions. The shielding people are able to perhaps work from home if you have the tools to allow them to do that. If they're self-isolating, that's similar. That doesn't necessarily mean they've got it. If they've come back from abroad, for example, it doesn't mean they've got it. It just means they have to self-isolate. And again, maybe they're able to work. But it's facilitating that. Adrian, have we got you on?
I think so, Geraint.
Wonderful. You come and save me at this point. So Adrian, you've probably missed what I've been talking about. I've been taking the audience through this slide that you've got in front of you. And I was just sharing about the fact that when people are off sick, some are sat at home able to work, others are actually off sick, and you've got to try and juggle all that. So over to you.
Yeah, sorry about the problems I've had, folks. Yeah, I mean, we've had, like every other care home, we've had staff off sick, so numbers have been reduced greatly, and they've been off for various reasons, whether that be self-isolating or shielding. And these situations in themselves brought a lot of anxiety in the beginning because we weren't sure whether they could be furloughed, whether they paid statutory sick pay, etc. A lot of these issues have obviously been resolved now, but we're still waiting to find out what the shielding situation is, because that's obviously been extended again till October. We then had the huge issue with PPE, having to look for items that we'd never ever purchased before, and then finding out that all our supplies, regular suppliers, had all their stock commandeered by the NHS and the government, and we were suddenly found having to deal with suppliers that we'd never heard of or dealt with in the past. And unfortunately, we succumbed to a fairly substantial scam, which is still ongoing. But can I just say, please be very, very careful, whoever you're dealing with going forward, because these people are very good at what they do. We've then had the situation with changing guidelines on an almost daily basis. But not only that, because we operate in different local authorities, we've had different NHS trusts giving us different information, and different health and social care partnerships issuing different information as well. So it's been a bit of a nightmare trying to keep track of all that ever-changing information. We have also you know, trying to keep in touch with people. We've been using Facebook on a regular basis, which has been great. It's fantastic. More of our relatives have actually engaged with our pages now that they're not able to come in and see their loved ones, and the vast majority of people have been very supportive. But again, we've had a few trolls out there who have caused us a few issues along the way that is fairly new to us in terms of dealing with that. Can you go to the next slide, please? So we've had to monitor the guidelines daily and be prepared to change accordingly at a moment's notice. And you know, how have we managed to do that? Well, this is where the digital side of things comes in, and we've always been very technically minded as a company, and like Ernie, we use person-centered software and a number of other systems such as Planday in order to maintain communication with our staff and have real-time information that allows us to evidence what we do, but also very quickly react to certain situations. So in terms of the monitoring the guidelines, we've been able to use Planday, which is an amazing tool in terms of communication with our staff. We've been able to target information to specific people as and when it has been required, and at the same time send out blanket information to all our staff. And that's allowed us to keep in touch with the staff, particularly night staff, and keep them involved and keep them up to date as things have changed. We've also conducted a number of Zoom meetings, daily and weekly, again with different groups of staff, and these have been new to us, but actually, like many of the things we've adapted to, will be ongoing once this dies down, because they've proven to be very successful, good ways of supporting individuals, good ways of sharing practice, and making sure we're all doing the same thing and we feel supported. We've kind of moved into another area now where care homes initially were, you know, we're getting applauded for what we're doing, and then the mood kind of changed slightly, and now I think we feel, certainly in Scotland, that we're under a bit more scrutiny as to actually what we're doing. So again, the likes of Planday and the other systems we use have been are there so that we can evidence precisely what we've done on a daily basis, and that gives us the confidence that we have that information readily available should anyone ask to see things. And then obviously, you know, we're about to undergo visits as well, which you know, again, because of the systems we have, we'll be able to evidence that information very quickly and far more clearly. In terms of how things have changed in the industry, I firmly believe that for a while the digital age was not taken on board, and some people believed that it wasn't necessary. I firmly believe it is entirely necessary now. I think it's certainly, you know, when people come in and see the systems that we use, they're blown away. And I think it's going to become more of the norm moving forward. Like Ernie, I firmly believe that, you know, having used different systems over the years, we equally take the approach where we've gone for best in market in each area, because we feel that's the right way to go. And Planday, you know, is certainly best in market in that field, both from the scheduling point of view, but more importantly from the communication point of view. It's allowed us to be far more in touch with all our staff, and also offer that helping hand and that bit of support, even if it's just to say happy birthday on the day of their birthday. It's made a huge difference, and I think our staff have appreciated that support and contact at all times. All right, thank you.
Oh, sorry, everybody. Just realized I was talking to myself with a mute there. Whoa, I'm not perfect. Fancy that. Apologies, everybody. So yeah, I'm just echoing Adrian's there. Really sad that you got scammed. There's a lot of you on this call. He won't be alone. I'm sure some of you have as well. So just everyone be extra vigilant. There's some bad people out there pretending to be really good. So here we go, on to Slido. So if I can invite all the panelists to turn their cameras on. So we'll have everybody up here to put these to. You've got a few moments now, everybody, if you can log in to Slido if you haven't done so already. Post any burning questions or challenges you've got for us. Look at the ones that are already there, vote them. We've already had some great engagement on that. So we already have, plenty to get started with. We're going to finish on time, everyone. I'll make sure of that. I really appreciate your patience in staying with us here. So that's fantastic. Okay, so everybody hear me okay, panelists? Some nods of the head? Yeah, perfect, there we are. So the top question that we have today, I would be interested in learning how to grow the business when the public are scared of inviting carers into their homes. So I'm going to suggest that's a domiciliary style question, outreach question. How do you grow your business when you've got this kind of challenge mentally from people? Anybody want to have a go of that?
If I can come in there, Gary, I think demand will continue, and I think certainly from our point of view, all we can do is trying to be as transparent as we possibly can, and try and reassure people with the policies and procedures that we have in place, that it's they're going to get the best care and the support that they need going forward.
Just to add to that, it goes back to the listening to the different voices that I talked about in the presentation earlier, just to say, we need to make sure that we really listen and understand where those concerns are coming from for that individual, rather than just assuming that we understand that they share the same concerns as everybody else, and really go to meet those concerns as best we can by being as transparent, as Adrian was saying, with our processes and procedures, and allow people to have the information they need to make their own risk assessments in an informed way.
Yeah, no, they're great. It is going to be a challenge. It is perception. You're very good at selling your business. You're very good at knowing what services you provide well. And it's just a tweak on that, be over the top clean, over the top infection control. Look for technology, can you put a tablet into somebody's home and do your 50-minute checkups? Loneliness is going to be a big challenge going forward. Is there solutions like that you can use? But yeah, I think they've been brilliant. Go on, Simon.
I would add to that around the technology, talking with various providers and sort of managers that have had some of the issues that you talk about, that having access to a phone that allows you to make a Skype call or a video conference call, so that there are times when maybe you don't need to visit at that time, but they can still contact someone if they need to. And that's a solution that I know some people are using. But I mean, to reiterate what Joss and Adrian have already said, it's a combination of things to sort of give people confidence. The demand is definitely going to be there. And it's a case of understanding the concerns and ensuring that you can answer well at any of those concerns and show demonstrably that you can actually do something to make them feel confident that you're the right service.
Brilliant. Thank you, everyone. So swiftly on to the next question. What data integration / visualization tools do you see being the forerunners over the next 3 to 5 years? So for example, Power BI, Tableaus, things like that. Now, if the panelists will allow me, I'd like to get my geek on this one. So, ladies and gentlemen, if you're a Microsoft company, if you pay for Microsoft 365 licensing and you use Outlook for all your email, Power BI is a bit of a no-brainer. It's within the Microsoft estate. Be careful, there's licensing, there's additional licensing to use it. The free version doesn't do much, lets you see things, but you can't actually send it to people. So be mindful of that. But I think Power BI is powerful. Microsoft are always developing it, so it's only going to get better. If you're outside of the Microsoft estate, you've got more freedom. And Simon, what's your thoughts?
Well, I was going to add to that with Power BI. There are a number of systems that that do other things like care planning, etc., that have got Power BI plugins, or in terms of their analytics, are using Power BI already, and the licensing that you get with that you can use for all your other systems. So you don't have to buy separate licenses for that. But having said that, as you were alluding to just a moment ago, there are quite a few other analytics systems. They all do a very similar thing. So what you'll end up finding with the likes of ClickView, Tableau, etc., some of it's going to be down to personal preference. Some of it's going to be down to the systems you're already using and how integrated they are with those. So Power BI would be the way I would go, because the majority of people are using Microsoft for lots of other things, and it is a bit of a no-brainer. But it will depend very much on what else you're using as to which direction you go, because they all are very similar.
Ernie?
If I can make a few comments as well. Something I heard a few years ago that really still sticks with me is that as systems become more available, kind of the system itself might not be as important as content. So years ago, obviously systems, when they weren't very flexible, you had to make sure you got your system right or you were dead. And most of the investment went into systems development. Now systems are pretty cheap, to be honest, but everything's about content. And if you can get the right content flowing out, the right data flowing out. Actually, guess what? I'm a big Excel fan still. Excel lives on, will continue to do if we can get the right content coming. And yeah, but Power BI and everything doubtless helps to process stuff and present it really nicely. But for me, it's all about content.
Brilliant. And if I can just finish on this point, what I will point out is data visualization is just that. It just makes a spreadsheet much prettier. If you're looking to extract data from various spreadsheets and systems and try and interrogate that data to look for themes and trends, you're not looking for something like Power BI. You're looking for an ETL system, an extract, transform, load system. If you type ETL into Google, you'll find lots. Alteryx is one that I'll kind of name drop there to help you search if that's what you're looking for. Brilliant. On to the next question. So will future design of care homes change? For example, will it be acceptable going forward to not have en-suite rooms? This is a really interesting one. Anybody want to take this? Yeah, Ernie?
Yeah, well, we've built quite a number of homes in the last few years, and our kind of priority increasingly has been the space that the residents live in themselves. So the angle's been, we've tried to move as far away from obviously institutionalization where people have to live in groups, and where I think years ago people would have said the bedroom was only for sleeping in, whereas we've moved more to having a space that people can feel is their own space. And that, yes, they got the choice to socialize with folk in shared spaces, but they don't feel that they've got to share everything with everybody, particularly when their friends and family comes to visit and they might want to have more intimate conversations. So I think the space that the residents have their own life to live in is even more important. And I think even for dignity alone, it's even more important that they got space that they can have their personal care done in without having to move outside their own front door.
Yes, good point. Very good points. Anyone else?
Well, I would agree with Ernie there. I mean, you know, the situation just now is you're having to self-isolate some residents. So obviously the more space they have, then the easier that process becomes. The problem is that the investment that extra space requires, and the market that you're in, whether it's, you know, it's obviously the self-funding market makes it easier to do these than it does if you're concentrating on local authority. So big questions there in terms of who pays for it at the end of the day.
Yeah, Joss, you can say something?
No, not now. Okay. Adrian's stolen my thunder.
So I'll come at it from a technical point of view. You know, I would love to see building regulations starting to put internet in as a standard. I think it's becoming a human right, and things like that. You know, could a day happen? You know, should I whisper this? Could a day happen when the local authorities pay for that? You never know. Could happen. So yeah, that's how I could see things changing.
Definitely to add to that, certainly in the last few companies I've worked with, the broadband capability and Wi-Fi in the home has become more and more important, and actually it's become a selling point to get residents to come. So I think that is definitely the way it's going, and especially as we're asking care homes to provide more and more electronic information via care planning systems, etc. So they need that capability on site anyway. But you know, more and more people that go into care homes are IT savvy themselves, so they might have a tablet or a computer, and they'll need that capability in the home for themselves as residents. But also things like smart TVs, etc., going into bedrooms are enabling that to happen too. So it's definitely moving that way in terms of new builds, and even the old homes are retrofitting decent bandwidth broadband into the homes now.
Okay, excellent. So I'm going to move on. So this one touches me a little bit. So I want to make sure that we do answer this. So we've had a message from a care worker in England. How can we improve care companies' attention to supporting staff's well-being and mental health? It seems very low on their priority and not built into business structure at all. Perhaps, Joel, can I pick on you?
Yes, I mean, I think absolutely that throughout this process, there has been an increase in recognition, not necessarily just from within organisations, because I hope that we held the value dear, but an increasing recognition of the people who work in social care and their incredibly important role that they play to support and care for our loved ones kind of throughout our lives, not just when we get older. And I think that now is the time that there is change afoot in terms of the recognition and importance of those roles. I think within organisations, it's important that, as I said, that we're communicating, and I think that communication goes both ways. So whilst it's important that the communication is coming from your senior leaders within the organisations, that also there are spaces for people who are working on the front line within services to communicate their thoughts and experiences upwards. And I think that grassroots change is really important. So we're also not just looking after the people within our teams, we're encouraging our teams to look after their colleagues as much as and look after themselves. So it's about the whole organisation's culture changing, and that can change through many ways, both from a senior leadership perspective, but also from a grassroots.
Anybody else want to comment? No, okay. So moving on to the next question. What is the future of agencies in all these changes in care homes, especially working with their vendors? I'm going to perhaps pick on Adrian or Ernie. As care home owners, What do you think this means for agencies that are trying to support you?
I think agencies have had a few knocks recently because people have been reluctant to have any agency or as little as possible into their care home for fear of spread. I think there's always going to be a need for agency. I think it will come back again. Obviously, as an operator, we try and do everything we possibly can to avoid it. But you know, one of the other things is if you bring in these digital software packages, then that helps if you do have an agency worker in, because they've got far more information at their fingertips about the individual, and you know, we can get a bit more person-centered care than we possibly get with a paper system. Yeah, I mean, you know, I personally think the things will bounce back in time, and we will see that there are always going to be nurses and carers out there who enjoy the flexibility of working for an agency, and you know, there's always going to be a need for it. But I think there maybe needs to, you know, going forward, maybe needs to be a closer working relationship between agencies and care home operators, so that you would try and get some sort of continuity going forward, and there may be a bit more, you know, if you happen to use an agency, then maybe that nurse should come in, or the care workers should come in and be familiar with your care home before they just arrive on your doorstep and expect to do the job.
Yeah, Ernie?
Yeah, I think so. The agencies is probably, as Adrian says, will always be there in some shape or form. And I do think it is how, as care homes, we work with them. I think there's a huge opportunity for agencies to embrace technology much better and more comprehensively, because basically, in a way, at the minute, it's a bit commoditized, and folk turn up with maybe a piece of paper with a A4 paper-based profile, and that's about all you get to know about them before you unleash them on your clients. Whereas that could be very easily online. We could easily electronically have a much better knowledge of the folk before they turn up. Maybe as well, one of the things we struggle with now that we're digital is you need to have people with all their personal logins. We can't be having generic logins, for example. So, and basically, if somebody comes in and doesn't have those given to them, they're person non grata. So that's, if agencies were to grapple with that and pre-qualify people into the systems that so many of us use now, I think that could be a great added value.
Yeah, that's a great shout. Brilliant. Okay, on to the next question. We're into the last 5 minutes, everybody, but we'll get through a couple more. So this is quite a big one. How to prepare for future outbreaks of any pandemic? You know, I've certainly read that, you know, one of the reasons China and South Korea coped quite well with this is they were used to outbreaks, and the population reacted as such. You know, what can we do here in the UK? Any ideas? Yeah, Simon?
One of the things that, you know, without wanting to get political about it, it's very much down to priorities centrally in terms of guidelines that care homes and social care in general are given around how to prepare for this. In the last few years, because of various cuts, etc., we've become less and less prepared for an eventuality like COVID-19. And that's part of the issue here. A lot of the homes, I mean, Adrian, I know we've spoken about this previously last week, was on top of things in terms of ordering PPE, etc. But because centrally they weren't organised, a lot of his supplies were diverted to the NHS, so it left him short in terms of being able to cope. So there needs to be thoughts in terms of actually having stocks available to be able to deal with things like PPE, etc., to have more rigid guidelines about what to do in terms of lockdowns and the processes around that, and not sending confusing messages out. And then it becomes a lot easier to manage when these things happen, and hopefully the lockdowns and the quarantines, etc., become shorter because we're more prepared as a nation. The problem is that we have, you know, groups vary in terms of their available budget for these things and their preparedness because of staff and stuff like that. But it doesn't help if in terms of central guidelines, we're not all working on the same page. So that's quite a big thing that's going to change things going forward. If we have another wave of this particular virus, or if something else comes along in the future, we need to have learned a hell of a lot of lessons from what has gone on, and be able to put those into play very quickly if we encounter something again, so that we don't get hit quite as badly. Because we all know the numbers are quite crazy in terms of what's happening.
That's good. Yeah, Joss?
Just to add to that, I think that the problem for social care kind of extends or began way before coronavirus came, in terms of successive governments have kind of failed to meet the funding gap and the needs for sufficient and appropriate funding for social care. And I think now potentially there's an opportunity for us to work together as a kind of sector to try and remedy that. The Health and Social Care Committee has just reopened its inquiry into social care, and they're working towards the new green paper around that, and maybe this time we might actually see something that comes from that. And I think that is critical to the sector's ability to respond resiliently in the future. You know, it's responded remarkably well in an environment of limited funding and resources. Just think how resilient it could be if we were actually able to fix the problem that's at its core.
Yeah, there we are, brilliant. So I think now's a good time to end on a positive. So we've had a fantastic message in from Elsa from Care Home Management Magazine. She mentions that it's Carers Week next week. How are care home providers going to celebrate this? So I think it's important we do a bit of a round robin on this one, if everyone can just kind of end positively and share some positivity around how this sector is going to enjoy the next couple of weeks. Who's going to go first? Okay, that's me. I've seen some brilliant ones. And what I'm going to do is I'm actually going to reflect back on what I said originally. Now's a time to recruit. Sorry, agencies, but now's a time to recruit. If you put out a really good recruitment process, a really good recruitment message, and nobody applies, you have still put out into the ether an incredibly positive message about working in care. So can I please encourage, you know, if any of you take my advice and do actually go out there and start doing some active recruitment right now, you know, just put great messages out about the sector, really shine a spotlight on the clapping that happens on a Thursday, and, you know, come and be part of that. So I think that'd be a great thing for some care homes to do. That's mine. Simon?
A lot of care homes already have. Sorry about that. Am I still muted? Are you sure?
Nope, sorry, there's a delay.
So. Okay. A lot of care home groups already have recognition, awards, etc., for their staff. I think more of that, and just making sure that staff know that they are valued by both their employers and by the residents and relatives around them. Just making sure that they know that they have the support, regardless of COVID-19, that they have the support around them they need. Different groups have got different financial constraints around what they can do, but I think a visual way of saying thank you is actually a good way forward for this, because you know the claps on a Thursday evening have been a great success because of that, because you know we are showing people that we actually care about the work that they do, and that's definitely a start.
Yeah, brilliant. Anybody else want to say anything before I bring this to close? Okay. Brilliant. So a massive thank you, Simon. Thank you, Joss. Thank you, Adrian. Thank you, Ernie. Thank you particularly to everybody that's been dialing into this. We've had an awful lot of you on, and that's been great. I think you've really enjoyed it. You've engaged brilliantly through the messaging, and that's been great. There's been other questions we've not been able to answer. Somebody's asked some details around a policy and procedure template for staff using new systems. That's always fun. I say fun. There's nothing fun about policies and procedures. So what you're going to get off the back of today is we'll communicate out to you. You'll get a copy of this presentation. You'll get a copy of all the slides. In there also, you'll have contact details of how you can reach out if you want to engage with any of the panelists here or Planday, anything like that. That's going to be coming out to you. I think you've been really, really great. It's been great for me to hear all this stuff. I'm sure we'll be putting some more on like this. So again, please respond to the email that will come out to you in the next couple of days if you want to see more things like this or which topics you would like us to cover. But no, finally, a big thank you again to the panelists. That's been absolutely wonderful. I hope everybody has a really safe time. Enjoy the end of COVID. We are the sector that's going to bounce back the fastest in the UK. Ride that wave, grow your business, recruit, and you know, give that positive message to your staff. It's going to be great. Thank you very much, everyone.